Hi friends, once again welcome back to the Nurse channel. So you all know that we are with our SCT JIPMER series and we have finished almost 3 series till now. So I believe you all have gone through those 3 series, and once again I thank you everyone for the support and the support you have rendered in the past videos. And now we are with our 4th series in the SCT and the JIPMER series, and one more information I am passing to you. And from this series onwards we are trying to include picture based questions also. And you know that in NORCET exams we will have picture based exams, picture based questions. Okay, so from this series onwards we are adding picture based questions also. So kindly make use of this platform, and once again I request everyone who are watching this video for the first time to subscribe our channel. Kindly support us by sharing about this platform to your nursing friends. Okay, so this is the 4th series of the SCT JIPMER series, and straight away we will move on to the questions. Okay, so we will see the questions by one, and kindly watch the video till the end, because what our explanations that I am explaining after each questions will be very useful for you for the preparation of your upcoming nursing officer exams. So all the best for the studies, and we will straight away will move on to the questions. Okay, so we will move on to the first question in our SCT JIPMER series. Out of the 15 questions, you can see the first question now on the screen. So the first question is, it's from the oncology. The most common cancer affecting children aged less than 18 years is. So the question is, which is the most common cancer affecting the children aged less than 18 years of age? So which is the most common cancer? So that's a question. And the option for you are, the first option A, brain tumors. The second option is spinal cord tumors. The third option is leukemia. And the final option is gastric tumors. So among these options, which is the most common cancer affecting the children aged below 18 years of age? So what is the answer? Yes. So obviously that leukemias are the most common cancers affecting the children less than 18 years of age. Okay, so we will see a little explanation regarding the question what we have discussed now. So we know that the most childhood leukemias are acute lymphocytic leukemia. Okay, so the question can be asked like this also. So they can give options like different types of leukemia, and in that leukemia, which is the most common childhood leukemia, means that is the acute lymphocytic leukemia. Okay, so the remaining childhood leukemias will be acute myeloid leukemia. Okay, so the first is the ALL, the second one is the AML. Okay, and chronic leukemias are very rare in children. Okay, so we are getting 3 information out of the first paragraph itself. So with the most common childhood leukemia is the acute lymphocytic leukemia, then comes the acute myeloid leukemia, and chronic leukemias are very rare in children. Okay, so and we have in the option we have seen that brain tumors and lung tumors, etc. So the brain and spinal cord tumors are the second most common cancers in the children. Okay, brain and spinal cord tumors are the second most common. So the first one is the leukemia, the second one is the brain and spinal cord tumors. Okay, so that's all regarding the first question. Now we will move on to the second question, that is, it is a simple basic biology. So the question is, the 2 classes of cells found in the human body are. So it's a very simple, very basic question. The 2 classes of cells found in the human body are. Okay, so we will see the options. The first option is the bone cells and the endocrine cells. The second option is the sex cells and the somatic cells. The third option is the permanent and temporary cells. And the final option is the muscular and nervous cells. So which is the answer? Which are the 2 classes of cells found in the human body? Okay, so these are based on the based on the type of the cell, we can classify them as dash. So the question also can be come like that. So what is the answer? So the answer is option number B, that is sex cells and the somatic cells. Okay, so we will have a small explanation regarding the question what we have discussed now. So the main difference between the somatic cells and germ cells is that germ cells is the sex cells. Okay, germ cells is that the somatic cells are involved in building the body of multicellular animals. Okay, so like human beings, the somatic cells are involved in the building of the multicellular building of the body of the multicellular animals. So on the other hand, the germ cells are involved in producing haploid gametes which participate in the sexual reproduction. Okay, so the germ cells are involved in the sexual reproduction and the somatic cells are involved in the body building. Okay, building in the body in the multicellular animals. Okay, so that is the main difference between these two, and the whole cells in the body can be divided into two as the germ cells and somatic cells, or the sex cells and the somatic cells. I think the explanation is adequate for this question, I believe. So we will move on to the third question in our series. The third question is, it is from the central nervous system, and the question is, the sciatic nerves arise from which of these plexus? Okay, the question is very direct question. The sciatic nerves arise from which of these plexuses? Okay, so we know that we have so many plexuses in our body, and the question now what is asked for you is the sciatic nerve belongs to which plexus. So the options are, the first option is brachial plexuses, the second option is the lumbosacral plexus, the third option is the choroid, and the final one is the cervical. Okay, so just to think about the position of the sciatic nerve, and very easily you can answer this question, and you know that the answer of this question is option number B, that is lumbosacral. That is, sciatic nerve is arising from the lumbosacral plexus. Okay, so we will have a small explanation of this question. We know that the sciatic nerve, which is also called as the ischiatic nerve, is a large nerve in humans and other vertebrate animals, and which is the largest branch of the sacral plexuses. Okay, so the question was regarding which plexus. So this is the lumbosacral plexus. From the sacral plexus we can get the sciatic nerve, which is otherwise known as the ischiatic nerve, which is a large nerve in the human beings and other vertebrate animals, and it runs alongside the hip joint and down the lower lip. Okay, so it arises from the sacral plexus and runs along the hip joint and down the lower limb. Okay, so it is the longest and widest single nerve in the human body. Okay, so you are getting a bunch of information regarding the sciatic nerve. So it is arising from the sacral plexus. The other name for the sciatic nerve is ischiatic nerve. It is the largest nerve in the human and other vertebrate animals, and it runs along the hip and down the lower limb, and it is the longest and widest single nerve in the human body. Okay, so many information you are getting out of this question. So now I think that question is very clear and it is very important. So next we will move on to our fourth question in this series. So as I told you in the beginning, in the introduction, that we are introducing picture based questions from this series onwards. So as you all know that exams like NORCET and all, as it is a computer based examination, definitely you can expect questions which are picture based. Okay, so, and several times in NORCET exams already they have asked also. Okay, so in other exams also, nursing officer exams also, you can expect these picture based questions very shortly. So keeping all these things in mind, we are also introducing picture based questions, and here comes your first picture based question in our series. And the series, this is a fourth question. So your fourth question is, identify the picture I have shown in the monitor right now. Okay, so identify the picture what you are seeing in the screen now. So this is the question, and the options for you are, the first option is endotracheal tube, the second option is Sengstaken Blakemore tube, the third option is laryngeal mask airway, and the final option is Salem sump tube. Okay, so identify this picture and tell me your answer. So what is this picture? So this picture is option number C, that is the laryngeal mask airway, or LMA. Okay, LMA, you might have heard about this instrument and you have seen these instruments in clinical settings, especially in ICUs and emergency departments. Okay, so we will see what is a laryngeal mask airway. So this laryngeal mask airway, or the LMA, are supraglottic airway devices. Okay, so this airways will rest in the supraglottic area, and this is used to maintain a patent airway. Okay, so they may be used as a temporary method to maintain an open airway during the administration of anesthesia, or as an immediate life-saving measure in a patient with a difficult or difficult failed airway. Okay, difficult or failed airway. So the purpose of this laryngeal air mask is to the first purpose is to administer anesthetic drugs and the other anesthesia, and other measure is like when there is a difficulty in intubation or in there is a failed airway, then we can keep the airway patent by the use of this instrument named laryngeal mask airway, or LMA. So there are several types of LMAs according to the age of the patient and size of the patient, so that you can refer later. Okay, so that's all about the laryngeal mask airway, and we have some other options in our question, and such one option was a Sengstaken-Blakemore tube. Okay, so this is a picture of the Sengstaken-Blakemore tube, and you can see that this is a triple lumen tube with one balloon here and one more balloon is there. So what I will explain what is this Sengstaken-Blakemore tube, or SBT. Okay, so this is a device which is used for the tamponade of bleeding esophageal varices. So what is an esophageal varices? You know that in cirrhosis and all there will be esophageal varices will be there. That means the dilated veins can be seen in the esophagus, and sometimes it can rupture and can result in upper GI bleed. Okay, so to arrest that bleeding we can use this device called Sengstaken-Blakemore tube. And this Sengstaken-Blakemore tube consists of 3 tubes. Okay, in the beginning I told that it is a triple lumen. Okay, it contains 3 tubes, one leading to a balloon that is inflated in the stomach. Okay, so the one lumen is there, and that will be leading to a balloon, and that is inflated in the stomach, and its purpose is to retain the instrument in place and compress the vessels around the cardia. Okay, you know the anatomy of the stomach. So in the cardiac position also, and what it will do is one balloon will be inflated, and that balloon will allow the equipment, the Sengstaken-Blakemore tube, to retain in that position, that means in the stomach, and it will compress the veins in the vessels in the around the cardia. Okay, and one more tube is there. One tube I told the purpose, and the other tube, it is leading to a long narrow balloon. You can see the balloon here, long narrow balloon by which the pressure is exerted against the wall of the esophagus. Okay, so the thing is, we know that bleeding varices will be there. So if we can identify the position of the bleeding, this balloon can be inflated in that point, and thus it can arrest the bleeding. Okay, so that is the purpose of the second lumen, and the third lumen is attached to a suction apparatus for aspirating the contents of the stomach. Okay, so the third one is for the suction purpose. There definitely there will be drainage will be there, and blood will be there. So those things can be drained out with the help of the third lumen. Okay, so the Sengstaken-Blakemore tube have 3 lumens, and the purpose also I explained. Okay, I think that is clear for you now. And one more option I have given for you was the Salem sump tube. So that we will see what is a Salem sump tube. So this is a picture of the Salem sump tube, and you can see that it is a double lumen tube. Okay, so Sengstaken-Blakemore tube is a triple lumen tube. This is a double lumen tube, and you can see that it is a nasogastric tube which is used for suction and irrigation of the stomach. Okay, so irrigation is one purpose and suction is the other purpose, and one lumen is attached to the suction for the drainage of the gastric contents, and the second lumen is an air vent. Okay, so that is a purpose of, that is a Salem sump tube. Okay, so don't be confused with the Sengstaken-Blakemore tube and Salem sump tube. Okay, and one more option was, it was a very easy option, and you all know about the endotracheal tube. I am not going in depth about the endotracheal tube. This is a picture of the endotracheal tube. Okay, so I think that question is clear for you. So that was a picture based question, and I think you understood that. Okay, so we will move on to the next question. Now we will move on to the 5th question in our series, and it is related to the pressure ulcers, and the question is, stage 2 pressure ulcer is characterized by. So now you just think about the stages of pressure ulcer and the characteristics of each stage, and with that you can answer the question very easily. And here comes the options for you. The first option, number A, the characteristics is full thickness tissue loss with exposed bone, tendon, etc. Okay, the first option is full thickness tissue loss with exposed bone, tendon, etc. That means the bone and tendon can be seen. The second option is full thickness tissue loss. There will be full thickness tissue loss. Then the third option is intact skin with non-blanchable redness. That is the third option, intact skin with non-blanchable redness. And the final option is partial thickness loss of dermis. Partial thickness loss of dermis. So stage 2 pressure ulcer is characterized by which of these symptoms? So answer. Yes, the answer is the option number D, partial thickness loss of the dermis. Stage 2 is characterized by partial thickness loss of the dermis. So we will see each stage very briefly. I will explain the stages of the pressure ulcer. So the stage 1, how it will be, the wound will be. So intact skin, the skin will be intact with non-blanchable redness of a localized area, usually over a bony prominence. So you know that the pressure ulcers can be developed in the bony prominent areas, and the stage 1 is characterized by non-blanchable redness of a localized area with intact skin. The skin will be intact. Okay, so that is stage 1. So then what about stage 2? The question was regarding the stage 2. In the stage 2, we can see that there will be partial thickness loss of the dermis. There will be partial thickness loss of dermis presenting as a shallow open ulcer with a red pink wound bed without the slough. Okay, so in this there won't be any slough, and there will be a red pink wound bed will be there, that the borders will be red. Then there will be partial thickness loss of the dermis will be there. So these are the characteristics of stage 2. Stage 1 only redness will be there, and the stage 3 we can see there will be a shallow open ulcer will be there, and there will be partial thickness loss of the dermis also will be there. So that is the peculiarity of the stage 2 pressure ulcers. Okay, now we will move on to the stage 3 pressure ulcers. The stage 3 pressure ulcers are characterized by full thickness tissue loss. Okay, there will be full thickness. Partial thickness loss will be the characteristics of stage 2. So full thickness tissue loss will be there in the stage 3, and subcutaneous fat may be visible, but bone, tendon or muscles are not exposed. Okay, here subcutaneous fat is visible. Okay, and there will be full thickness loss of the dermis will be there. Okay, that is stage 3. So what will be stage 4? In the stage 4, there will be full thickness tissue loss will be there with exposed bone, tendon and muscle, tendon or muscle. Okay, so in stage 3 subcutaneous fat will be seen, and in the stage 4 there will be full thickness tissue loss will be there, and along with that there will be the bone will be exposed, or the tendon will be exposed, or the muscle will be exposed based upon the area of the pressure sore. Okay, so I think the stages of pressure sore is very clear for you with a single question. I think the explanation is adequate. Now we will move on to the next question in our series, that is the 6th question, and the question is, in which of the following parts of the colon do most malignant tumors arise? Okay, so the question is regarding the position of colon cancer, position of the malignant colon cancer. Okay, so which of the following parts of the colon do most malignant tumors arise? So just think about the parts of the colon and answer this question, and your options are: the first option is hepatic flexure, the second option is transverse colon, the third option is rectosigmoid colon, and the final option is in the cecum. So where we can expect the most malignant colon cancers? So what is the answer? So here the answer is in the rectosigmoid area. Okay, action is option number C, that is rectosigmoid. So we will see, we know that the sigmoid colon is the most common site for the cancer of the colon. Okay, sigmoid colon is the most common site, and rectal carcinoma is the most common cancer of the lower gastrointestinal tract. Okay, so the rectal carcinoma is the most common cancer in the lower gastrointestinal tract, and in that, in the colorectal cancer, the sigmoid colon, sigmoid colon is the most common site for the development of the most metastatic colon cancer. Okay, so we will move on to the next question, that is from the cardiovascular system, and it is a confusing question, and it is a very, very important question, and it was asked several times in several competitive exams. And the question is, cardiovascular phenomenon characterized by groups of two heartbeats close together followed by a longer pause is dash. Okay, so the question is a direct question, but it's little confusing. The question is, cardiovascular phenomena characterized by groups of two heartbeats. There will be two heartbeats close together followed by a longer pause. So the options for you are: the first option is bounding pulse, the second option is water hammer pulse, the third option is pulse alternance, and the final option is bigeminal pulse. Okay, so don't be confused with the options here. Read the question very carefully and answer the question. So the question is, a group of two heartbeats close together followed by a longer pause. So you will be confused with the two options, I know, that is the pulses alternance and the bigeminal pulse. So we will have a detailed explanation of this question after finding the answer of this question. So you know that the answer for this question is definitely option number D, that is a bigeminal pulse. Okay, bigeminal pulse. So we will have a brief explanation of the different types of pulse what we have given in the option in this question. So the first we will see about the bigeminal pulse. Okay, so the bigeminal pulse, that was the answer for the question, and we know that which is a pulse which is characterized by two beats close together with a pause following each pair of beats. Okay, so there will be two beats which are close together with a pause following each pair. Okay, two beats will be there, then a pause will be there, then two beats. Okay, like that. If it is coming means, then that is known as the bigeminal pulse. Then definitely you will have a doubt like, then what is the difference between pulses alternance? Okay, so that we will explain at the end of the discussion of this question. So next we will see about the bounding pulse. What is a bounding pulse? So bounding pulse means, as the name indicates, it is a strong throbbing which can be felt one of the arteries, one of the arteries over the body, and it is due to the forceful heartbeat or the forceful ventricular contraction. Okay, bounding, as the name indicates, it is a strong throbbing pulse which can be felt over one of the arteries in the body, and it is due to the forceful heartbeat. Okay, so we have explained about the bigeminal pulse, and next the bounding pulse. Now we will see the another pulse which is known as the water hammer pulse, otherwise known as collapsing pulse. Okay, so water hammer pulse and the collapsing pulse, what it is that it is a physical exam finding that it describes a bounding. It is also a bounding type of pulse, and it is a forceful pulse with a rapid upstroke and descent. There will be a rapid upstroke, there will be rapid upstroke will be there, and at the same time then there is a descent will be there like a collapse. Okay, so that types of pulse is known as the water hammer pulse, and I am not going in detail about these pulse because you should understand in which all conditions we can expect this type of pulses. Okay, that is so if you are getting time, just go through that. Okay, that also is very, very important, and we will try to include those also in the next coming sessions. Okay, so kindly continue watching our sessions. Okay, so that's all about the water hammer pulse, that is a collapsing pulse. Okay, now we will see the another pulse what we have given in the option, that is pulses alternance. So always pulse bigeminal pulse and pulses alternance will be a confusing thing. So pulses alternance is a physical finding with arterial pulse waveform showing alternate strong and weak pulse. Okay, so it is an arterial pulse form which is alternate strong and weak pulse. There will be strong pulse will be there, and at the same time weak pulse will be there. Okay, so alternatively strong and weak beats will be visible in the arterial pulse waveform. Okay, that is pulses alternance. Then definitely we will have a doubt like, then how we can differentiate between bigeminal pulse and pulses alternance. So my one question for you is how to differentiate between these pulses alternance and bigeminy or the bigeminal pulse. So it is very simple. The pulse must be absolutely regular to diagnose pulses alternance and distinguish it from the bigeminal pulse. Okay, which also has the beats of alternating strength, although the rhythm is irregular. So so what you understood about this is the pulse must be absolutely regular. If the pulse is regular, and then we can term it as a pulses alternance, and in the bigeminal pulse also we can get sometimes strength will be different. Okay, like weak pulse will be there, strong pulse will be there, same like pulses alternance, but the thing is the rhythm will be irregular in bigeminal pulse. Okay, so this is the thing that distinguish between pulses alternance and bigeminy. Okay, I think this explanation is adequate for the question what we have asked, but this is not up to the mark. The thing is, actually you should also find out, okay, in which all conditions we will get pulses bigeminous, pulses alternance, then bounding pulse, water hammer or the collapsing pulse, etc. Okay, so that is an assignment for you, just go through that. Okay, so that's all regarding the question what we have asked regarding the pulse in the central nervous system, cardiovascular system. Now we will move on to the next question in our series, that the 8th question. It is regarding from the foundations of nursing regarding enema. So the question is, type of enema used to stimulate peristalsis by irritating the intestinal mucosa and to soften a hard stool is. So the question is regarding a type of enema which is used to stimulate the peristalsis by irritating the intestinal mucosa and to soften a hard stool. Okay, so if the patient is having a hard stool is there. So we have to soften the hard stool, and it will be stimulated by the peristalsis, but creating irritation in the intestinal mucosa. So that type of enemas are called dash. That is the question. That is the explanation of the question. And here comes the options for you. The first option is carminative enema. The second option, option number B, is purgative enema. Option number C, laxative enema. And the final option number D, medicinal enema. Okay, so just it's a very simple question. Question is little big, but it's a very simple question. So answer the question. So which is the type of enema what we have asked in the question? Answer. So definitely the answer is option number B, that is purgative enema. Okay, purgative enema is the answer for the question. So we will see a little about information about different types of enema what we have explained in the what we have given in the options. So purgative enema, otherwise known as the evacuative enema. Okay, purgative or evacuative enemas involve injection of nearly 1 to 1.5 liters of water or soap solution at 25 to 30 degrees Celsius in order to stimulate the peristalsis by irritating the intestinal mucosa and to soften and a hard stool. Okay, so in that we are getting so many informations, like, so we are using in the purgative or the evacuative enema, we are using water or soap solution, and the amount is nearly 1 to 1.5 liters, and the temperature of the solution should be 25 to 30 degrees Celsius, and the purpose of this purgative enema is to stimulate peristalsis by irritating the intestinal mucosa and to soften the hard stool. Okay, so this is the answer for the question what we have asked, and in this session also you are getting a lot of information regarding purgative or evacuative enema. So the other option was regarding laxative enema. Then what is a laxative enema? So laxative enemas involve the injection of 50 to 200 ml of vegetable oil or 50 to 100 ml of a hypertonic solution of table salt, magnesium sulfate and sodium sulfate, and which is used when strain is undesirable in evacuating the bowels. That means in case if the straining over the stool is contraindicated of the or if the patient don't have the capacity to strain over a hard stool, then we have to think about the laxative enema, and it involves the injection of how much ml? That is 50 to 200 ml of vegetable oil or 50 to 100 ml of hypertonic solutions of table salt, magnesium sulfate and sodium sulfate, and it is used for the undesirable when straining is undesirable in evacuating the bowels. Okay, so that is the difference between laxative enema and purgative or evacuative enema. Okay, understood, no? So now we will see the another type of enema what we have given in the option, that is a medicinal enema. So what is a medicinal enema? Medicinal enemas involve the introduction of medicinal substances to act directly on the intestinal mucosa or to be absorbed through the intestinal walls. Okay, so medicinal enema means, as the name indicates, it is the introduction of medicinal substances to act directly on the intestinal mucosa or to be absorbed through the intestinal walls. That is very simple. Okay, so I think one more option was there, that is regarding the carminative enema. So what is a carminative? So carminative means related to the gas. Okay, so a small volume of enema will be given to release the flatus. Okay, so the gaseous distension, everything can be reduced with the help of carminative enema. Okay, from this question we have explained about the different types of enemas, and I think you got a brief introduction or a brief information regarding the types of enemas. Okay, so that's all regarding that question, and that explanation is adequate, I believe. Now we will move on to the 9th question in our series, that is simple physiology. The question is, phagocytosis takes place in. Question is very simple. Phagocytosis takes place in. So the options for you are, first option is option number A, red blood cells. Option number B, neutrophils. Option number C, lymphocytes. And final option number D, platelets. So phagocytosis takes place in which of these cells? So slightly confusing, no options. So what is the answer? So the options number B, neutrophils, is the answer for the question. So we will have a brief explanation regarding the question what we have asked now regarding the phagocytosis. So what is a phagocytosis? What is the process of phagocytosis called? Phagocytosis is the process by which a cell uses its plasma membrane to engulf a large particle, giving rise to an internal compartment called the phagosome. So what is phagocytosis? and what is phagosome. So two terms we are explaining in this explanation. So phagocytosis means it is a process by which the cell uses its plasma membrane. Its own plasma membrane will be used to engulf a large particle, okay, and they will give rise to an internal compartment. After that engulfing with their plasma membrane, there will be an internal compartment will be called, and that compartment is known as the phagosome. Then which cells are involved in the phagocytosis? That was the question we have asked. And the most effective phagocytic cells are two kinds of white blood cells. Okay, so there are two kinds of white blood cells are mainly involved in the phagocytic activity, and they are the macrophages and the neutrophils. So in the question we have given the option neutrophils. So the neutrophils is the correct answer for the question. And you know that the macrophage is the large phagocytic cell, and neutrophils are a type of granulocyte. Okay, so WBCs are involved in the phagocytic activity, and in that itself, WBC itself, the most effective phagocytic cells are of two kinds, that is the macrophages and the neutrophils. Okay, so that also is clear for you. So we have learned about what is phagocytosis, what is phagosome, and which cells are involved in the phagocytic activity. Okay, so that also I think it is very clear for you now. Now we'll move on to the next question, that is a question number 10. The question is, which among the following fluid is also called as Hartmann's solutions? Okay, so direct question again, which among the following fluid is also called as Hartmann's solution? Okay, so this is a regular fluid that we are using in the clinical settings, and the options for you are, the first one is normal saline, that is 0.9% saline. Then B, lactated ringer or the ringer lactate. Option number C, dextrosine saline, that is our DNS. And the final option is half saline or 0.45% saline. Okay, so what is the answer? Which solution is called as the Hartmann solution? So to confuse you, they have given options like A and D, the half saline or normal saline. Okay, so don't be confused. You know that the answer for this question is option number B, that is lactated ringer. Ringer lactate is otherwise known as the Hartmann's solution. Okay, so what all things are there in the lactate, ringer lactate, that we will see in our small explanation to the question. And the ringer's lactate solution, also known as the sodium lactate solution or a lactated ringer or Hartmann solution, is a mixture of sodium chloride will be there, sodium lactate will be there, potassium chloride will be there, and calcium chloride will be there. It is in the water. Okay, all these things are mixed in the water. So sodium chloride, sodium lactate, potassium chloride, and calcium chloride in water. So the normal replacement of the potassium replacement will be happening through RL, and sodium replacement also will be happening for especially for the NPO patients and all. Okay, so that is the ringer lactate solution. Okay, so I think it is clear for you now. So ringer lactate, otherwise known as the Hartmann's solution. That was the question asked. Now we will see the 11th question from the central nervous system, and the question is very simple. Which part of the neuron receives information? Okay, question is very direct, very simple. So which part of the neuron receives information? So the options for you are, the first option is the myelin sheath, the second option is the dendrite, the third option is the axon, and the last option is the rod of Ranvier. So which part of the neuron receives information? That's a question for you. Simple direct question, and the answer is option number B, that is the dendrite. The dendrite is the part of the neuron where the informations are received. So dendrites are the finger-like cells present at the end of a neuron, and this fiber increases the surface area available for receiving the information, incoming informations. Okay, so the dendrites are the receiving or the input portions of a neuron. Okay, so it's very simple question. Now we will move on to the 12th question in our series. The 12th question is, the risk factors for prostate cancer include which one of the following? Okay, so the question is regarding the risk factor for prostate cancer. Okay, so just think about the prostate cancer and you can answer it very easily, and the options for you are, the first option is option number A, castration before age 40 years. Castration means that is sterilization before 40 years of age. Then option B, black race. Option C, Asian race, and option number D, young age. So which is the risk factor for the prostate cancer? Risk factor for the prostate cancer, whether it is a sterilization before 40 years or the black race or the Asian race or young age, which is the risk factor? So you can omit some options very easily. So give me the answer. So the option is option number B, that is black rice. Okay, so we will see the risk factors for the prostate cancer. So we know that the black rice and increasing age are associated with an increased risk of prostate cancer. Okay, black rice and increasing age is associated with an increased risk of prostate cancer, and on the other hand, incidence is very low in those of Asian race and in the men castrated before the age of 40 years. Okay, so before the age, if the sterilization happened, and the Asian race people, they are having a low incidence of development of prostate cancer, and on the other hand, black race people and increased age are at risk for development of prostate cancer. Okay, so that also is a very informative question for you. And now we will move on to the 13th question in our series, that is regarding lung cancer. So which one of the following symptoms is rare in patients with progressive lung cancer? Okay, so the question is, which one of the following symptoms is rare in patients with progressive lung cancer? So just think about lung cancer and a chronic lung cancer patient, and which symptom is not present. That is a question asked, which is very rare in patients with progressive lung cancer. Okay, so the options for you are, the first option is hemoptysis, the second option is hypercalcemia, the third option is headache, and the final option number D, urinary retention. So what will not be present in a patient with progressive lung cancer? That is a question for you. So answer. So what is the answer? The answer is option number D, urinary retention. So other options like hemoptysis, hypercalcemia and headache can be seen in progressive lung cancer patients. Okay, we will have a small explanation for this disease, for this question. So we know that the hemoptysis and hypercalcemia and headache are very common symptoms in the patients with progressive lung cancer. Okay, so now we will move on to the second last question in our series. This is from the central nervous system, and it is regarding the myasthenic crisis. And the question is, which among the following is a precipitating factor for myasthenic crisis? Okay, so just think about myasthenia gravis, myasthenic crisis, cholinergic crisis, etc. And the question is, which among the following is a precipitating factor for myasthenic crisis? So the options for you are, the first option is option number A, getting too little exercise. Okay, getting too little exercise. Option number B, taking excess medication. Okay, so if the patient is taking excess medication, whether that is the reason for myasthenic crisis, that is option number B. Option number C is omitting doses of medication, that is medicines were not taken. And option number D is increasing intake of fatty foods. Okay, so which of the following can result in the development of myasthenic crisis? That's a question for you. The options looks a little tricky, but it's a very simple question. So what is the answer? Obviously, answer is option number C, that is omitting doses of medication. So if we skip that is anti-myasthenic medicines, the patient can end up in myasthenic crisis. Okay, so I will be explaining regarding the myasthenic crisis and the cholinergic crisis. So myasthenic crisis often is caused by under medication. Okay, if the patient is not taking the medication, that may be a cause, or there will be under response, okay, to the administration of the cholinergic medications. Okay, so we are giving cholinergic medications for the myasthenia gravis, such as neostigmine or pyridostigmine, etc. Okay, neostigmine and pyridostigmine are the drug of choice for the myasthenia gravis. And if the patient omits the neostigmine or the pyridostigmine, which is an anticholinergic medication, their chances of getting worsening of the symptoms, that is the myasthenic crisis. If the patient is not taking the medicine, there will be chances of worsening the symptoms of myasthenia gravis, and that is termed as the myasthenic crisis. So the answer for our question, what we have asked now is, what is the cause of myasthenic crisis? That is omitting a dose of or multiple doses of medicine. Okay, that is myasthenia crisis. Then we should understand what is cholinergic crisis. Cholinergic crisis is caused by the excess medication and a response to withholding of the medications. Okay, so if the patient is taking excess medication and it is a response to the withholding of medications, and that can resulting in the cholinergic crisis. Okay, so that's all regarding the question what we have asked. Now we will move on to the last question in our series, the 15th question. Risk factors for the ovarian cancer include which of the following? Okay, so the question is regarding the risk factors of ovarian cancer, and the options for you are, the first option is young age, the second option is nulliparity, the third option is multiple pregnancies, then the final option is prolonged use of oral contraceptive pills. So the question is regarding ovarian cancer. So don't be confused or don't make a hurry in answering the question. Read the question very carefully, just go through the options very carefully and give me the answer. Risk factor for ovarian cancer, whether it is young age, nulliparity, multiple pregnancies, or prolonged use of oral contraceptive pills. So what is the answer? Final question, last question. So the answer is nulliparity. Okay, nulliparity. So we will see an explanation for the question what we have asked now. So the risk factors for ovarian cancer include increased age. So as the age increases, there are chances for getting any type of cancers. And nulliparity. What is nulliparity? The patient didn't conceive at all. Okay, that is nulliparity. So the risk is reduced when the risk will be less by factors that reduce the number of ovulatory cycles. Okay, so the ovulatory cycles, if it is getting reduced, then the chances of getting ovarian cancer also is less. So that means pregnancy. So the as the number of pregnancies increases, there will be less chance of getting ovarian cancer, and prolonged use of oral contraceptive pills. Okay, so in these cases the chances of getting ovarian cancer is very less. On the other hand, if the patient is nulliparous, that means the patient is not conceived yet and the patient's age is increasing, means those things are highly risk for developing ovarian cancers. Okay, so with that we have come to the end of another series of 15 questions regarding the SCT series, and once again I thank you everyone for watching the video till the end, and I request everyone, if you have any doubts regarding the questions what we have discussed here, or if you want any further explanation regarding the questions what we have discussed today, you are very free to ask, and I'm expecting your doubts and your suggestions in our comment boxes. So expecting your full-fledged support in our in this venture, and once again thank you for watching the video till the end, and kindly stay in touch or keep in touch till the next video comes. Okay, so thank you.